Tuesday morning, the 11th of April, and our main story is that in the last couple of minutes, a 4-day strike by junior doctors in England has begun, and it's expected to be the most disruptive in the history of the NHS.
More than 250,000 appointments and operations could be cancelled, but doctors say they are striking for patient safety as well as pay, as our health correspondent Catherine Burns reports.
This winter, we've got used to seeing NHS staff waving banners on picket lines. We're now into the 5th month of industrial action. But this walkout by junior doctors in England is bigger in scale than anything that's come before. A 4-day strike from this morning straight through until Saturday morning. The timing is key here. The bank holidays and weekends mean the last date of usual weekday staffing levels was Thursday, April the 6th, and the next, Monday the 17th. The BMA is being accused of picking dates to maximise disruption. Their view is that industrial action is supposed to cause some disturbance.
We've been open and honest and transparent through this whole process. Our ask has not changed because all we're looking to do is restore the pay that juniors have lost. But at every opportunity that we might think we can break through, it seems they have another precondition, another hurdle, another obstacle for us to go through.
NHS bosses will prioritise A&E in areas like maternity, neonatal and critical care. But they expect many, possibly around 350,000 routine appointments to be postponed, including Philip Fisher's surgery to tackle constant ear infections. He says it shouldn't have come to this.
When I received the phone call, I was gutted. I ended up crying because pain, unbearable. Now, what do I do? What do I do now? I just have to wait. Why is it cancelled? Who's accountable? How many more people are like me?
This will be the second junior doctor strike this year. They also walked out in March. At the heart of this, pay. They want a 35% increase to make up for years of below-inflation wages.
That's a large demand, when you think about it. Don't get me wrong, I do think they should have an increase, but 35% is a lot.
I support them. I think I've got nothing against what they're doing. I just hope that it does get kind of sorted out quickly.
It's really unfortunate if you're needing a major operation or you've been on a waiting list, but ultimately, I think it's the only way that things can change.
I think they do need a significant pay rise. Obviously, 35%, they're aiming very high.
The Health Secretary, Steve Barclay, calls the 35% pay demand unreasonable. He says it would result in some junior doctors receiving a pay rise of over £20,000. If the BMA is willing to move significantly from this position and cancel strikes, we can resume confidential talks and find a way forward. That approach has had some luck with other unions. Nurses, ambulance staff and physios are voting on a 5% pay increase, but not so far with the junior doctors. Catherine Burns, BBC News.
Well, Catherine is live now outside the Leicester Royal Infirmary for us this morning. Morning, Catherine. So how big an impact is this strike going to have where you are and at other hospitals across England?
Well, the big priority is going to be emergency care, because what's going to happen is routine care, routine operations, they will be cancelled, a certain amount of them. Last time the junior doctors went on strike, it was 175,000 of them. This time, this strike's 4 days, so it's going to be more than that. And actually, the timing between the bank holidays, in the school holidays, means that the potential impact could be much more. There are talk of up to 350,000 appointments cancelled. The heart of all of this is pay. As I said, the junior doctors are asking for this 35% increase. Other unions are voting on a 5% offer. Well, I'm joined now by Dr. Vivek Trivedi. He is the co-chair of the BMA Junior Doctors Committee. Vivek, this 35% increase that you guys are asking for, do you think you're going to get it? How realistic is that?
Good morning. So this uplift that we're asking for is only to reverse the pay cuts that we've had. Doctors have had a more than 26% real terms pay cut over the last 15 years. And in monetary value, all we're asking is for a doctor who's paid £14 an hour to be paid £19 an hour. So it's not a tall ask, and like we said before, we're willing to negotiate on how we get there. But for that to happen, we need Mr. Barclay to negotiate with us.
So you spoke about Steve Barclay, then the Health Secretary. He has said that you guys have timed this strike for the maximum possible disruption for NHS patients and staff. Are you worried about patient safety?
Patient safety is at the forefront of every doctor's decision on a daily basis. So we want to make sure we're doing what we can to keep patients safe, but ultimately a strike by nature is designed to cause disruption. We showed in our strikes in March that actually the cover from our senior consultants and specialty doctors are able to maintain a good patient care on the ground, and that's what we're seeing happen set up for this 96-hour strikes. But there will be conversations to continually assess and monitor the situation if anything changes.
There has been talk about the war of rhetoric between you guys and the government. How do you think this is going to be climbed down from? How is this going to end?
Well, we've been quite clear and transparent from the start. We're willing to get to the table, and in fact, we've offered multiple dates to Mr. Barclay to try and meet. He's only met us twice, didn't have a mandate to negotiate once, and didn't even give us an offer the second time. So I can only urge Mr. Barclay to come back to the table so that we can continue these discussions, and if he puts a credible offer on the table, we can cancel these strikes. We don't have to strike.
Great, thank you very much, Dr. Vivek. There has been talk of the conciliation service, ACAS, being called in between the two sides here. In the meantime, though, the question is for patients. What are they going to do over this 4-day strike? Well, the NHS is open for business, but it's not business as usual. If you're sick, try your GP, community pharmacy as usual, try 111. If it's an emergency, and only if it's an emergency, call 999, because that is where the care will be prioritised over the coming days.
Catherine, thank you very much indeed. And we will be speaking to representatives from NHS England and the British Medical Association just after 7:30 this morning.
Just now, though, it's coming up to 10